Motive there. Today at 4, we are learning more about the Hantavirus outbreak linked to a cruise ship. And this morning, health officials in Nebraska said 18 American passengers have now been flown back to the U.S. and taken to a specialized quarantine facility in Omaha. It's designed to handle highly infectious diseases.
Officials say one passenger did test positive for the virus and is now being treated inside a biocontainment unit, while another passenger with mild symptoms is receiving care in Atlanta. So what should Houstonians know about the virus, and should anyone here be concerned? Our Rochelle Turner spoke with infectious disease expert Dr. Peter Hotez and is joining us live in the newsroom with what he had to say. Rochelle?
Lisa, Joel, good afternoon to you. He basically said that the stress that he continued to stress that the risk of the hantavirus to the general public remains extremely low. And as for the two passengers from the Houston area who were on that cruise ship, the Texas Department of State Health and Human Services says they are not showing any symptoms. Officials say those passengers were not sent to Nebraska for monitoring because they left the ship before the virus was identified and had already returned home. So I asked Dr. Peter Hotez what Houstonians should know.
You know, the initial exposure probably happened off ship. Probably the initial infection occurred when a couple was in southern Argentina.
Dr. Peter Hotez says it's important to understand the incubation period, meaning the time between when a person is exposed to the virus and when they can actually start showing symptoms. Symptoms usually appear about 3 weeks after exposure. They can take up to 6 weeks to develop, and health officials trace this outbreak back to late March or early April.
So the likelihood is those two individuals who are in Texas who were exposed to the virus, I think there's a good likelihood they will not turn out to have a hantavirus infection. So the point is, this is not COVID. It's not nearly as transmissible as COVID.
Should we change anything to protect ourselves and our families?
There should be no fear in terms of getting hantavirus infection, at least from this epidemic. You know, if you are concerned, one of the things to recognize is that, you know, rodents, mice, rats do transmit other virus infections. And so if you have these animals in your garage or near around your home and you're sweeping up, you know, rodent feces or dried rodent urine and dust, you might want to wear a respirator mask and some glasses or goggles to protect yourself.
So again, the two passengers from the Houston area are not experiencing any symptoms. State health officials are not releasing additional details to protect their privacy, and experts stress the risk to the public right now remains very low. Reporting in the newsroom, I'm Rochelle Turner, KPRC 2 News.